deal with people who've got experience, life experience, and a story to tell.
I've lived through wars and passed that history on.
I've met Spitfire pilots, I've met people who work in mines, I've met people who build ships.
Professionally, it's complex, it's always different. Someone's poorly with one thing, but there's all these other comorbidities going on at the same time, so it's challenging, and you've got to always think outside the box, haven't you?
I tend to encourage my friends to come and care of the older people. You become more fulfilled because you know that at some point you would also grow old.
You tend to look after them for longer, there's continuity, so you do build those relationships, and I really like that.
Because they've got lots of needs, so obviously it helps me develop as a student nurse because you see everything, like a range of all different care needs.
I feel very humbled to support patients to leave the world, a bit like midwives feel humbled to, to bring people into the world.
Making people who are really poorly when they come in back to being healthy again, so they get home, and seeing them getting a little bit more independent and get to go back to their own homes.
It's never the same day or every day, so you're always coming into something new, so it never gets boring.
It has helped me in my communication. I used to be very shy. But now when I came on this ward, I had to be in charge of a babe. So it has really helped in my communication. I'm now bold.
I was given plenty of opportunities. Been sent on numerous courses, clinical skills. I've been to conferences and spoke in London.
I've started here way back in the 90s as a student nurse. Then I've progressed to nurse practitioner level, so I was supported to do my clinical skills, supported to complete my degree, and I feel well supported by the medical teams.
I actually started my career out on Ward 19, which is one of the other wards here at South Tyneside, and then I was fortunate enough to be promoted to a Band 6 role in the community, also working with older people, and then I was encouraged after a couple of years, after progressing, to come back and apply for the ward manager's role.
I've managed to do my preceptorship and my mentorship, and they've helped me go through my degree and part of my masters as well, and they've allowed me to go off-site for training as well.
Working with older people is definitely really good for nurses, especially when they first qualify. You get a wide range of conditions. You look after cardiac patients, respiratory patients, endocrine patients. We'll get dementia and delirium patients, so it's a really good grounding. And then it leaves you the opportunity after a few years, if you want to develop, to go into other roles.
If you're ever thinking about working with older people in the future, my advice would just be to come to the wards and work within those environments, because if the family atmosphere doesn't get you the interaction with the people, absolutely will. You'll meet some wonderful people that you would never get the opportunity to meet, perhaps in your day-to-day life, and I think as part of that experience it actually broadens your outlook on life as well. And I've got a totally different outlook on life than I perhaps did 10 years ago as a result of my job.
You can learn so much. Like I say, everybody's different, and you can learn so much from one individual to the next. Just be open-minded.
Go for it. Like, it's challenging and rewarding, and I don't think it's like that anywhere else in the hospital, to be perfectly frank.
Because it's one of the most rewarding jobs I've ever done. I've done other specialities and never quite enjoyed it as much. The patients are amazing. Watching them get back better from being poorly is just absolutely amazing, and it's just such a rewarding job.